Why do tests you deem unnecessary or that are repeat keep on being ordered? Welcome, I am Martine Bruce, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. So why this trend of repeating tests, labs, scans, procedures by every doctor you see and at close intervals? Here's the why as I understand it, and solutions with tips to help you along. First, a reminder. Your treating physician always is your best source of medical advice. I never provide nor promote any medical advice. This video is only offered for general information and educational purposes only. So, the concern. The healthcare system is clogged with repeat services, labs, tests, scans, procedures. It seems that every medical provider orders their own, regardless of previous encounters. Patients are left not understanding why they must repeat or undergo so many of those, and at their own cost. I see two main reasons. Let's start with clinical. The fear of malpractice runs doctors' professional lives. Medical errors have been on the rise, one of the leading causes of death in the US, according to some studies. The doctors I used to work for would often say, better safe than sued. Taking every precaution, reducing any risk of missing something, ruling out any possibility, however remote, translates in a huge number of tests, which patient might consider excessive or futile. Specialists will also order test lab scans that focus on their own specialty. And that's what you want. You don't get a new transmission at a tire place. But this localized knowledge also implies exclusion of consideration of other body parts or systems. Actions and options may also be limited to a specific scope of expertise. And treatment options, of course, would be limited to what the specialist can offer. Miscommunication among providers is an issue at times, especially under emergency conditions, preventing a timely exchange of information and duplication of tests that have already been performed or are not needed. You may be tested in the ER for anything under the sun that your yearly physical last month already ruled out. And unless you, the patient, mention it, a physician may not know you just had blood drawn by someone else or that imaging reports are available. Lack of trust between medical providers, yes, it exists. Some providers may look down on lower specialties and may dismiss a medical opinion or judgment unless issued by someone of a similar or higher level of expertise. There might be a reluctance to trust an unfamiliar provider or unknown source. Many physicians may repeat testing at a facility they have come to trust or by personal choice, disregarding one done elsewhere. There are financial reasons too. First one, we're back to malpractice. Those premiums are expensive and have been increasing dramatically the last few years. So the one way to reduce premiums is not to be sued. But the worst culprit has been the fee-for-schedule model. Medical providers are paid for every service treatment item they provide. Hence, the more services, the more money. While it would be incorrect and unfair to assume that every doctor out there orders as many services as possible for financial gain, the model does not encourage restraint or careful use of resources. Results, quality of care, clinical needs may fall second to the bottom line. And more services used mean a larger share of cost for you, even with insurance, and of course more stress and wasted time. Fortunately, there are a couple of good solutions. If you are an HMO patient, this part does not apply to you. Anybody else, do get a PCP. My special video on HMO and PPO will explain it. A PCP coordinates care, gathers the medical records, facilitates communication between providers. The centralization lowers duplication of services, reduces the risk of errors, and maximizes resources, ultimately saving us, patients, money. And the value-based care system is a new payment system introduced a good decade ago. Providers here are paid based on the quality of the care they render to you, and of course the results, not on the number of services. The switch from quantity to quality is encouraged at every level of the healthcare system and has been expanding. There are advantages: streamlined medicine, improved overall care management, lower costs to your insurance and therefore to you. But making a profit may mean less care for an okay result instead of more care for an optimum one. Increased scrutiny by insurance to lower cost is a must. Quality values may be difficult to report, and some specialties like oncology may be penalized because of the high levels of bad outcomes. As for some tips, it is always a good idea to ask questions. What is the need for this test or procedure? I've recently had something similar. Can the results be used? Can your office obtain a copy from another doctor instead? Will the insurance cover it? And do communicate. I would forward all copies of records or reports to my PCP and provide that PCP's contact information to any other office I may visit. They can then request a copy of my chart. I would keep my prescription list current. I would also keep on hand a list of in-network pharmacies and labs. And of course, update my insurance information as needed. Now, physicians should not feel threatened by questions from patients, especially once you explain. Your peace of mind and need to better understand your situation require more explaining. You can also get a second opinion or go elsewhere. Shouldn't your medical team be there to treat and heal you, even if they do need some guidance at times? Because let's not forget, we patients have rights. Insurance companies have a duty to their members, and medical providers must follow guidelines and legal mandates. I so thank you for watching. Please subscribe, like, and comment. Only with your help can this channel grow to reach out to many more patients just like you. So thank you.